I hope you can hear me now, Niranga.
Yes, yes, it's very clearly right. Yeah.
Yeah, I see Sally also has joined. Hi, Sally. Hope you can hear me. Yeah, okay. So thank you, everyone. Good morning or good afternoon or even late evening for some joining from Southeast Asia. Thank you all for joining this webinar session. I think this is in follow-up to the global early warning webinar series we have been organizing for more than a month. And this particular series is more to look at the important hazard we have been facing during the summers usually, that is the heat wave. And we have lined up global experts joining from around the world. And we would begin that in a couple of minutes. And when we talk about heat wave, it is something where we hear from WMO and many other agencies that we are making a record-breaking heat temperature that have shooted up in Asia, South America,
Excuse me,
or
Giriraj,
Europe.
I'm getting very feeble voice from your end. It is a problem with my is case with me only or
Niranga, can you confirm you can
very
hear
low
me?
voice?
There is no issue with the voice. It's coming.
Okay,
Your voice is
let
clear.
me check
Giriraj,
my
I
system
think
in
it's
that case.
Yeah.
the Barnes one. Yeah.
Okay, thank you. Maybe Dr. Bond to mute. Yeah. So thank you. I hope the technical issues are addressed. So I'm just saying that this heat wave is an important threat, and we talk about the record-breaking temperature rising around the world, impacting societies and community. And this particular series is mainly to understand the urgent need of heat wave early warning system. We'll be hearing from two global experts from WMO, retired expert, and also John, who is part of the various advisories in early warning systems related to heat wave. And we will be also hearing from Dr. Sally when I introduce them when it comes to the health related impact from the World Health Organization. So without much delay, let me introduce the two experts that they will be speaking on very short intervention on what do we mean by heat wave early warning system. Dr. John is the Managing Director of Climate Extreme Consulting and served as a Senior Advisor on extreme heat with the World Meteorological Organization. He has a PhD in meteorology and oceanography. He developed Australia's national heat wave warning framework, specifically the heat factor index, because at the end of the day, we need a threshold what anticipate action the local level agencies to the top down or bottom up institutions have to make timely action. So I would call upon Dr. John to speak in 10 minutes or so roughly to highlight the significance of the heat wave and what actions the lessons that can be learned for the participants. Over to you, Dr. John.
Thank you very much. It's a privilege to be here, and I hope I can get to this quickly. Next slide, please. So my content today is roughly around the ideas of what is a multi-hazard early warning system, and then the various forms of extreme heat services and the standards that we need to consider. Next slide, please. So with all of the weather services that are provided, we use a weather intensity phenomena concept, one where we're looking at any phenomena such as wind or rain or the like, and we will observe and forecast and share the information that we gather, and then we'll reach an intensity level where we'll warn. Seems simple, but it is the principle that's behind a multi-hazard early warning system. The reason why I say this is because all of the information before the warning is extremely valuable and important. And this becomes really important when we want to consider what we're doing with heatwave. Next slide, please. So that's just a quick touch on the idea that you have public and severe weather services under a multi-hazard early warning system, and that weather phenomena are intensity-based. The next slide, please. So when we're characterising heat waves, as I was asked to do with the WMO, it became rather impossible to do because there's too many different things happening out there, a lack of standards. So I rather chose to characterise extreme heat as a super title for the problem. And when we look at it, much of the work out there is done with climate temperature extremes, and people are actually warning for temperature extremes, not for heat waves. And I can go into that a bit more deeply. The other thing that we're complicating ourselves with is the idea that thermal extremes, which are really about human heat budget, is a separate discipline, and it's often mixed up with the temperature conversation. So the idea that you're looking at temperature, humidity, possibly radiation and wind. But when we actually go to heat wave and we consider it as a weather phenomena which has intensity, we'll begin to look at the degree hours as a way of understanding intensity, and there are attributes there that are useful when we try to consider heat wave as a weather phenomena. Next slide, please. So I'm sharing with you the country I come from, the Ghana people. They're named for a heat wave. Next, here's a Wotawinkuru heat wave. So next slide, please. So I'm setting up for here an idea of that orange line there is the local significant temperature threshold that's been chosen. It can be percentile, it can be a fixed number, but often, certainly in my work, I've used percentile. And there's a diurnal variation of temperature over time over 3 days and nights. Next. No, yeah, thank you. And there's, if you like, over those 3 days, the maximum. And that's often used as a way of looking at a heat wave. I regard that to be an indicator for a heat wave. And then the next slide, yes, thank you. The T-min, a characteristic that is sometimes used, but sometimes can be useful. Next, please. So what happens is really what we're considering when we're talking about heat, which I regard to be the joules question, energy question, rather than the Kelvin temperature question. We can characterize the heat by or excess heat by the time spent over that threshold, the cursor, the movement of temperature over time. And that's the energy rising there with that purple curve. If we look at the evening and next, we can see that we're actually discharging that excess heat. And then if we go next, so that cycle is repeated. And so, yes, next. So I would say, no, this is not a heat wave. It's a sequence of hot days. And there's environmental discharge. So it's actually an environmental heat budget I'm talking about as a way of understanding this. Next. And another example, next, where we can see the sequence of discharge, energy accumulation and discharge, just to give it another idea. And if we characterize that by the next, yes, we can see the energy oscillating and then finally rising because we're getting excess heat, cumulative excess heat. Next. So another example where the maximum doesn't change, but the minimum rises. Next. So the sequence of energy is more cumulative. And next. So we have a totally different energy cumulative across that sequence of days. So those two events share the same maximum temperature, which is a climate extreme characteristic. The unusual minimum temperatures often characterize heat waves. I am generalizing, but it's a principle I'm demonstrating. So max and min in combination can parameterize the heat information. Next. So there's a definition. I won't dwell on that, but local cumulative excess heat during a sequence of unusually hot days and nights is what I regard to be a meteorological definition of heat wave intensity. Next. And if we look at a climate distribution of temperature, that's a typical slide I pinched from somewhere, where we've got both the PDF and the cumulative distributed density function. If we look at the tail, and you can see that red line there is sitting in the temperature range, but it's right on the tail. Next. And that chart there on the right is the CDF, the fat tail of that distribution that's left over. And this is a way in which I regard heat wave to be characterized under this distribution. And in fact, in the technique that I've developed, this is actually a Pareto distribution function, and the 80-20 rule, or the 85th percentile that we chose, was a threshold for the rapid increase in intensity. And all that information in the trivial many is actually extremely valuable to the community because we're telling them something where they have capacity to manage heat, and we're familiarizing with the idea that it's a weather phenomena. and it actually lends itself into the multi-hazard early warning system paradigm that all weather services can employ. Next. So what I regard here is that this is a group of complementary approaches to the extreme heat paradigm. Heatwave intensity, a meteorological environmental question. Heat health, human thermoregulation, is one where we do want to consider the impact of humidity. These can be fall across each other. They can occur at different times. So we need to actually see them both employed as a means of advising and alerting the community to the hazards that they face. But the interesting thing from my point of view is that the human health component is one where I regard that the meteorological community, in some regard, the health community got there first and created the demand for our services, Met services. And in some degree, they captured the Met services, and we didn't quite get to heatwave as a weather phenomena. And we're playing catch up in my interpretation. Next, please. And here's an example of a complementary suite of services, if you will. The top left is what Australia does with heatwave severity. It's a percentile technique. We've normalized it with the Pareto distribution function characteristics. So we talk about severity of heatwave. We provide no temperature data. It actually leads people to go to the temperature data to dive in further. So it is actually just a heatwave severity service. Below it is the corresponding climate maximum temperature record corresponding to that day. And to the right, I've pulled out a bunch of charts from ECMWF thermofield, where you can look at the different thermal indices that are more important to human exposure. So next, please. So quickly, this is just a 1 minute excursion, understanding how I think things have worked. Health have made demands. The weather services have gathered climate data and created a heatwave hazard, or possibly also temperature hazards. Health have acted on their own often and gathered climate data and produced heat vulnerability, and then often created their own heat health warnings, which is a separate loop. But when we share the heat vulnerability data with the weather service and they provide a service to health, we can get coordinated parallel services, which are, if you like, impact-aware heatwave forecast and warnings, and impact-based forecast and warnings from health, totally coordinated. It's the concept, I believe, is what we're after, via vertical integration of data custodians. And lastly, it's a value chain approach, which is key to co-design and trusted partnerships. Next. So, in summary, public weather services. Low intensity services are critical because there's so much information there that is valuable to the extremely vulnerable communities, or people who are vulnerable in ways in which we don't consider to be warnable. But once we reach a threshold above, we definitely have the public warning services. But also it is a service to all other sectors. So when we look at extreme heat services, we have the climate, temperature extremes, we have heat health, thermal extremes, heat wave, it's a weather phenomena. You can create and serve all sectors that are impacted rather than just one sector. And if you want to do common alert protocols, you need to consider that you're doing them separately for temperature extremes, thermal, and heat wave. Next, please. Thank you.
Thank you, John, for this excellent presentation. I think I would not repeat what you said. Specifically, I like the three important factors at the end you summarized in terms of the heat wave, that's an extreme phenomenon, what we talked as a weather characteristics, and the important is the standard protocols that would help the next sector, the sector institutions to work together. And I think the important part of heat wave, we always talk about the global cooperation. That is very, very important because the forecast skills coming from the global players, whether it is WMO, NOAA, or any other agency, it's really paramount to see how those heat factor or the index you define that would bring policy aspects and also the collaboration across the institutions that we work together. Next, I would like to bring on now the important topic coming from Dr. Sally Jane Edwards, who is a coordinator for health and the environment from the WHO Western Pacific region. She has a vast experience in epidemiology with focus on climate change impact on health, developing early warning systems for heat waves, drought, and climate sensitive diseases. I think without any further delay, I would like to hear from Dr. Sally and all the participants. I request you have any questions to both the speakers, do use your chat box to ask your questions, and we will be moderated by Dr. Sanjay Srivastava. Over to you, Dr. Sally, at this point.
Thank you very much, and good evening, good day, good morning, depending on where you are. So I want to talk a little bit about the health side of things, and I'm doing this presentation both on my behalf, but also on behalf of Jason Lee, who's the director of the Heat Resilience and Performance Center, but he's also the chair of the WHO-WMO GIN Southeast Asia Heat Health Hub that's based out of Singapore. Next slide, please. Oh, sorry. Do you want me to share the slides? Sorry.
Yes, you can do it. Yep.
Sorry, my apologies. Share. There we go. So as has been said, extreme heat is an urgent and growing threat to many parts of our human body. This is a very complex slide, but really emphasizing really the internal organ issues from extreme heat that we see. Sorry, I'm just moving. The body heat budget, as John was just talking about, as it increases, the body's ability to thermoregulate is impaired, and this leads to physiological strain. And that strain is not only has direct health impacts, it also has indirect health impacts and broader health impacts, so outside of the health system as well. And the true global scale and magnitude of the impacts aren't really known. Although we recognize a lot of them, they're underreported and underestimated. In the Asia-Pacific region, we have a unique challenge of high temperatures, high humidity, and coupled with sustained exposure, we're talking quite a lot of months of the year. And how heat affects us is very much contextual. So some parts of the Asia-Pacific region, the humidity and the long exposure is extremely critical to understanding how our behavior shapes our risk. So when we talk about impacts, we must talk about risk, and the impacts are realization of that risk, with risk as an outcome of the interaction between the four main determinants of heatwave related risk, namely heatwave attributes, such as the frequency and duration and intensity, the associated heatwave hazard, the heatwave related exposure and vulnerability, and responses to heat waves. It's important to know the key determinants of heat strain. How hot is a person? What is their heat burden? We cannot assume that a hot environment always results in a hot person. But at the same time, we can't assume that humans will not become hot when the weather is moderate. It is so dependent on so many other determinants. Existing health conditions can also increase the risk of incurring severe impacts of heat, such as heat stroke. When this happens to them, regulatory responses are insufficient, and that heat gain exceeds the heat loss of that particular person. And if we cannot cool that person, they enter into a non-compensatory thermoregulation state where the body's core temperature rises uncontrollably, and it's at that point extremely important to cool that person and get medical attention. Nearly every heat death, though, is preventable. We need early warning systems, as explained by John in the previous presentation, but they must be, and what is that? It's where people receive relevant, timely, systematic information prior to an event in order for them to make informed decisions and to trigger prompt public health interventions so that a reduction in risk can be achieved. Now, they rely on in-depth reviews by epidemiologists of data for the local setting. They rely on statistics, but that need to be extracted where the significant changes are seen, and they can't be drowned out in routine tables of weekly data because we can't pull out what's important. The 4 essential elements of an early warning system for health are risk knowledge. So what are the risks of the people, as I explained in the previous slides? The detection and monitoring of both the risk and the situation, the warning, dissemination, and communication, so enabling people to take informed decisions and enabling the healthcare sector to prompt public health interventions, and then the preparedness and response capabilities of the health sector itself. Now, as John explained also, that we need to weigh the hazard-based versus the impact-based systems of early warnings. So do we really want to focus on the meteorological side or really look at the human impact system? But it's extremely important to tailor the systems to local climatic and demographic conditions and risk conditions. So when we look at the data, how do we measure the impacts on heat? There are different ways. We can have measured impacts, such as our surveillance systems, but also model impacts that are studies and that they're projecting. Yes, there is heat-related mortality. We all know a lot of the statistics, but the heat-related morbidity is often hugely underreported and under-recognized, but actually contributes more to the impact of a heat wave than the mortality. So when we look at considerations around alert and warning systems, we also need to understand that there are pros and cons of different ways of doing it. We need to understand how high ambient temperatures affect us. But a lot of the data on temperature and physiology is understood. The exacerbating factors are, in a lot of ways, understood. But how to incorporate these into a heat wave early warning system and response system together and include consequences of climate change is an area that's still being worked on. We also know when we're looking at communication, when we're looking at messages, some of the messages around heat waves contradict some of our other health messages. So we talk all the time when we're talking about non-communicable diseases about increasing exercise, having better nutrition. But the heat exposure elements impact that. So are we still telling people to go out and exercise when we're in a heat wave? So we need to weigh the different messages coming out. Ventilation, cooling, and airborne infections and heat, we saw during the COVID-19 pandemic what a critical role ventilation played in spreading that infectious disease. But with heat, we're saying we need to be ventilated because we need to keep indoor cool. So how do we weigh those? There is also warning fatigue that, excuse me, we need to be cautious about when we warn, not to warn too early, but we also can't wait too long. We need to determine the start of an event. We need to determine the end of an event, and these need to be done in the local context before, but also understanding that there are many other warnings that happen all the time. We have air quality warnings very often in this part of the world, typhoon warnings, heat's another warning. If people are listening to different warnings every day, do they take the action that is required? Human memory is short. So how do we really change human behavior long term? And that is a critical question across the health sphere. But for health and heat, it's very critical that we try and understand how we bring about these changes. There's also, on the operational side, a balance between prediction and capacity. So there's no point in predicting a heat wave if we don't have the capacity to deal with that in that location. It just creates angst and some mental health consequences. For health, heat action plan is extremely important, and there are 4 very clear pillars of that, which includes the capacity building of medical professionals to these issues. And I wanted really to bring in what the Global Heat Health Information Network Southeast Asia Hub is doing. So we need advisories to be contextualized, no one size fits all. And this is in part what the Southeast Asia Hub is being made for and trying to do in this region. It focuses on 3 key areas. So one is around urban heat and the challenges of urban heat in this region, where we have huge urban conglomerations and big issues to do with heat island effect. It also focuses on occupational health and heat at work. We know that these people are exposed for very prolonged amounts of time and often do not have respite from the heat. But we also want to recognize that there are traditional and cultural practices that are in existence and that we can learn from and bring in. And of course, this is all part of the Global Heat Health Information Network. And I put this as my last slide. It's a big resource on heat health that's available to everybody. And so as we've gone through, I've listed some other resources that I've used, but it's a Network is an independent, voluntary and member-driven forum. It has scientists, practitioners and policymakers, but it's a really fantastic resource when it comes to heat and health. And with that, I'd like to thank you.
Thank you, Dr. Sally, for this excellent presentation. I hope it was very enlightening for all the experts. I would not really go into more detail about what you just highlighted, but I really like the line you talked about on the operationalization capacity on the heat wave extremes to balancing between the prediction skills and the capacity that the hospitals, the sectoral institution, the local government, you talked about across the human system, how heat stress is quite alarming and a warning in terms of the livelihood losses that is happening. With increasing climate change, this is even more far-reaching impact that is expected. I do see there is a questions for both Dr. Sally and Dr. John. I would request you to just go through the important questions they have highlighted and please respond that. In the interest of time, I would now invite Dr. Sanjay Srivastava. Hope you can hear us. Dr. Sanjay Srivastava is the Chief of Disaster Risk Reduction at the United Nations Economics and Social Commission for Asia and Pacific. In short, it is ESCAP, based in Bangkok. He leads quite an interesting portfolio. I have known him for many years, and that's one critical reason I want to bring ESCAP into this important session to moderate the gaps between the research and policies and how do we address that. A topic like heat wave is very, very important to look at the risk management and the kind of innovations and the economics behind that is even more challenging. And that really brings into the experts that they have joined for this session. I would now invite Dr. Sanjay to maybe take one or two questions from the participants, and then we can move on to the moderation. Over to you, Dr. Sanjay.
Uh, uh, Thank you, Dr. Giriraj and colleagues. I think it was truly enriching to listen from the two experts, a meteorologist and a doctor, two different perspectives on the heat and health. So, if there are any questions, it's not in front of me from the audience. One or two questions. Is there anybody with the question?
One
Sanjay,
hand
if I
is
may
raising.
share
I'm
the
giving
Q&A
the chance
session.
to answer the question.
Yeah, please, please.
So what we could do is you can move on to the panel, and then we can come back to the experts at the end of the time permits, how
I
we can
think
do that.
I think that is better.
Okay.
After panel discussion, we will take all the questions and then discuss one by one. So thank you, colleagues. You just heard two perspective on extreme heat, truly enlightening. Now, before we start the panel discussion, I have just 3 points to share with you. The first is the adaptation gap, particularly for the extreme heat, is going more into the hard adaptation pathways. So what to do? We have the fact is the heat risk outspacing resilience and adaptation. That's the fact number one. Exposure to critical population sectors are all on the rise. So when risk outspaces resilience, what to do? That's the question which I think I will request panel in the different deliberations to address one by one. The second part was many policy actions. I'm so happy that the panel is comprising a scientist, Dr. Bhan, a policymakers, Rijvi Saab, and a think tank, the person who takes policy down the line, Biswa Chitlate. So we have a wonderful panel composition. So the panel, we will discuss on the policy action side. My last point is the heat risk governance, whether we should take into the sector to system or sector to nexus approach. So I think the panel, we expect to do a deep dive in these three areas when risk is outpacing, then policy actions, choices becoming limited and limited. And then the third part is the risk governance. So if I start this from our colleague, our friend, Dr. Bhan, he has made a lot of efforts in his role as a DDG, Deputy Director General of Indian Meteorological Department. So my first question to Dr. Bhan is, how can the IMD enhance the spatial and temporal resolution to better support city level planning and public health response? So over to Dr. Bhan.
Thank you, Sanjay. Thank you very much, and good morning, good afternoon, and good evening to all the participants here in this very important webinar organized by IWMI, and I thank the organizers. Though I'm not with IMD any longer, but having worked with IMD, I would try to provide the perspective from their side and the plans what they have, particularly in context of the improvement of heat wave warnings and improving the temporal and spatial resolutions as asked by Sanjay. So at present, the Ministry of Earth Sciences, which is the governing controlling ministry for all the weather-related activities in India, at present are running two global models at 12-kilometer resolution for generation of the weather forecast in medium range scale, and WRF at 3-kilometer resolutions, which is centered over South and Southeast Asia for forecast at relatively finer resolutions in short range scale, that is up to next 3 days. And the output from these models are used by the India Meteorological Department to generate the forecast at district and state level. And obviously, these coarse resolutions lead to some errors while downscaling the forecast to city or now what we need at sub-city scale levels at urban heat islands is becoming a serious phenomena as urbanization is increasing, the density of population is increasing in bigger cities. At the same time, the ministry has got very firm plans in place for increasing resolution of the models. I hope that if the present plan goes on, because the augmentation of the high computing power system is in place as of now, and they propose to start a global model at 6-kilometer resolution and a regional model at 1-kilometer resolution, which are expected to provide better forecast at city and sub-city scales, and also at better temporal resolution to take care of the diurnal variation, which is important as John had pointed out just now. And I hope these systems would be in place before next summers. The summers of 2025, we have to manage with the existing systems. And by next summers, these finer resolution models with hopefully better forecasts at finer resolutions would be there in place. Also, as we know nowadays, this data science is finding place in meteorology in a big way. The ministry has established a dedicated centers on AI/ML and deep learning at the Indian Institute of Tropical Meteorology, which is located in Pune, primarily to strengthen the research and development activities in the fields of AI, ML, and into deep learning, which I'm sure are expected to result in investment of improvement in the weather forecast. And with all these efforts, I'm sure the resolution of the forecast, both horizontal and temporal, would improve. Accuracy of the forecast is also expected to improve as the model resolution goes up. And IMD has got an elaborate plan of enhancing the observation systems. Some 2,000 automatic weather stations, 60 additional Doppler weather radars, finer resolution satellites. ISRO is helping IMD to design the satellites for it. And inputs from all these.
Yeah. Dr.
Am I audible there?
Yeah, Dr. Bhan, just 1 second, because of the some time constraint. If I just ask one follow-up question,
Yeah,
and
please.
that is related to, because your response is very clear on a spatial and temporal resolution challenges, and now what government is doing to address those challenges. Another important question is the challenges and opportunity to integrate this heat forecast data with local government and health system in the country. If you very quickly share some of your experience, that will be great. Yeah, the challenges.
The opportunities, of course, is a
Yeah,
better
you have
resolution of the
already
forecast, increase in communication.
Right.
Those are the opportunities before us.
Right.
And the challenges remains. The challenges of improved
Local,
location specific
local,
forecast. And it's more
level,
the challenge lies in customization of the forecast.
right.
John pointed out for specific users
Mm.
and effective risk communication to these target groups. What is happening now, IMD, because of lack of inputs from the users, is providing the same forecast, same warnings for all the groups.
Yeah.
Whereas vulnerabilities are different. So that
Right.
vulnerability needs to be established. Thresholds needs to be established for different
True.
users.
Yes.
That is there.
Right.
Another challenge what we have, John very rightly pointed out in one of his slides, that combined effect of both the maximum and minimum temperatures, both.
Yeah.
That as of now is not there.
Mm, mm.
Also, though we are providing information on humidity, but that needs to be integrated into an index, and which
Yeah.
has to be indigenous. IMD does provide some information on NOAA-based heat index, but those indices, as we know, are not very useful for tropical countries.
Yeah. Yeah.
So the academic institutes have to help us out, help IMD out. I'm not with IMD any longer. To quantify the heat index so that customized advisories can be provided.
Yeah.
Vulnerabilities are not so well established.
Yeah.
Dr. Rijvi is there. He is one of our biggest customer. I think NDMA definitely has taken note of all these things through various discussions, and they can play a bigger role.
Yeah.
Also, communication of risk perception
Yeah.
remains at relatively low level, particularly among the vulnerable groups, and also information on preventive measures to be taken at different alert levels, information of cooling mechanism and access to the cooling centers, those need to be popularized, and identification of symptoms
Yeah.
and access to the health facilities. If I can summarize it, Sanjay,
Right.
simply put together, it's a problem of co-design and co-production.
Okay.
That remains a challenge. So we have to
Excellent.
rope in more
Yes.
users and jointly come out with the products.
Right.
That's
Excellent.
a challenge before us.
Co-production, co-utilization. Wonderful.
Thank you.
My next is Safi Ehsan Rijvi Saab, the advisor of National Disaster Management, Government of India. I don't think we will have a better person than him to respond to some of the question. The first and foremost is how is NDMA working to institutionalize heat action plan across vulnerable state cities? I think that's a question which we expect some insights from your experiences in India.
Thank you. Thank you so much for Mr. Srivastav and for this excellent workshop that has been organized. Online is the way to go now, and this is the best way. Everybody saves on time and their organizations save on money. As regards heat, the whole problem of heat in India is that it's so diverse. The country is so diverse. It has so many agroclimatic regions. It has the heat impact in itself. When the IMD, as Dr. Bhan mentioned, when the IMD has to designate as to what is the heat threshold, you have three separate heat thresholds for the whole country. Then how you calculate what is a heat wave and what is maximum temperature, minimum temperature, what level of humidity you have to take, and what level of wind factor you have to bring in for IMD to calculate what is the actual heat impact. So all these factors are so complex for a wide region like India that it becomes very difficult to have a kind of one agency with one metric, with one model looking at everything. So they've come up with several diverse models, IMD. And for, as Dr. Bhan mentioned, every district gets a separate heat warning. Early warning systems they have, and the heat warning they get is separate for every district and, of course, for every state. Just to mention for everybody on the call, we have 36 such jurisdictions, 28 are states, 8 are called union territories. They're essentially very large areas, and there are about 750 and rising each day number of districts in the whole country. So the task is massive. Now we've set out trying to push heat action plans for every possible city that we can find in this country. We have excellent support from think tanks like CEW, which is on the call, and we have Dr. Vishwas on this call. He has been a great help to us. Many such think tanks, non-profits are coming forward to support the creation of heat action plans. Now, a heat action plan pushed through the Government of India or even from the state government for a faraway district in that state will have no effect. And even if the district magistrate of that district pushes it, it will have no effect unless the municipal officer sitting in the municipality who has to administer the heat action plan is involved with it. So, our big task is to get our state disaster management authorities involved in pushing this task onto the municipal officers so that they ally with think tanks like CEW and they assist and both of them work together and it becomes their plan. Only then will they be able to implement. So this is one big thing that we are trying to do.
Right.
And we have a large number of plans there in some hundreds at times. Whenever you get to count, you have a larger number and a larger number. So it's getting very difficult to exactly count how many. Then the big story about each of these heat action plans is that we are focusing on assessment being at the as much granular level as possible. And there is a balance between depth of science or depth of assessment that we can go to and practicality. So for the municipal officer to be able to deal with the kind of nuance that science or heat assessments would provide, we don't want to take him down to an absolute scientist level. We want to take him to a level which he can understand, he can do something. And lastly, I'll mention, given that there is a paucity of time, as Mr. Srivastava has said, is that the government of India has already 12 disasters or hazards that are mentioned in its list on which public funds can be spent. Heat has been added recently. And so all the $30 billion of funds that we have over 5 years for disaster risk management, they can also be expended on heat. So this is giving a great fillip to heat action plans, early warning systems, IMD's efforts, and various other such inputs. Thank you.
Thank you. Thank you, Mr. Riju Saab. This is what we were looking forward to listen from you, and especially the public fund exclusively for heat is a great news. I think this is India many times has led a lot of TRR related, including the heat action plan, Ahmedabad to start with. So this is yet another leadership example.
Can I make one small quick point?
Yeah.
So quickly, I'd like to add that in India, we have been increasing our focus on from just human health to animal health. We have an entire ministry on animal husbandry. So the amount of livestock which outnumbers our 1.4 billion people by 3 times. Livestock is 3 times. So the importance of heat on them. That's number 2. Number 3 is crops. We have a whole agriculture ministry and a lot of research institutions that focus on crops, and a lot of heat resistant varieties are there. Number 4 is water. How to deal with the impact of heat on water. CWC, Central Water Commission, works on that. And lastly, infrastructure. So power, transport, railways, energy, various energy things, ports, everything is fairly resilient of heat because their radiant temperature is 60 degrees and not 48 degrees of ambient temperature. So India has done a lot in adaptation. And if any of the participants of this meeting wishes to reach out and get some direct orientation, we are always willing to do so. Thank you.
Thank you. Thank you, Riju Saab. This is really what you said, the whole spectrum of adaptation to heat wave. My final question to you is a little bit provocative because we hear quite a bit in UN system, that is what we call the role of anticipatory action protocol. So from NDMA point of view, the anticipatory action protocol for heat action plan, what has been your experience and some of the key learnings from NDMA side?
So I will have to plead ignorance to this question because you have thrown a question which wasn't in my syllabus. It may be called something else here, but if you can quickly explain in a minute, then I'll be able to get the context.
Actually, this anticipatory action is gaining a lot of, acceptability, especially in the early warning, early action context. So suppose before heat wave sets in, you take necessary actions, who are the potential vulnerable group, you reach out to them for a variety of interventions, many you named very clearly. So from that point of view, the anticipatory action protocol for heat action plan in India, anything that you feel
Very clear. I like the UN for the amount of jargon that it uses. So thank you for the gentleman or the lady who invented this AAP term. You see, before anybody had heard of heat action plans or micro assessment or granular assessment of what can be done in which ward or which locality or which city, we have a concept of district magistrate. So every district is governed by an executive district magistrate or an officer of the government of India. So there is always, just before the heat season, somewhere in mid-March, there is a meeting at the district level of all the officials, and they are told that number one, you have to provide public areas where you provide cool drinking water, not iced, but cool drinking water, which is easy to provide in the back of beyonds also. Then everybody is advised not to reduce working hours, especially in the heat. And schools are normally shut in the peak summer, and if they are open, then they are advised to shut at 10 a.m. or 11 a.m. So these 3-4 things are always done, and with each year, with all the knowledge that we provide the districts, some districts now put out a 17-point advisory, but they do it 15, 20, 30 days before the actual thing happens. And then when there's a heat wave advisory from, say, IMD saying that 3 days from now you're going to have a serious issue, so then they issue an additional advisory. So that's the jurisdictional system that is available. Then there is a functional system. In the functional system, there are 7-8 categories of unorganized employed workers, like labor, construction labor, or labor working out in the open, or railway workers who are doing something, de-stressing the railway tracks. So all these people are directly reached out to by the Central Ministry of Labor and the state ministries. And therefore, their welfare and why they should not be working on these days, or maybe their work should be reduced by half, their salaries could be paid more than half. A lot of small such measures are made. And if you have delivery workers, gig workers, like all these home delivery apps, so they are generally nobody insists, but they are encouraged to open pool shops or little water stations along the road for them. So every specific company, at least in Delhi, has started. They have a pool water station for their delivery workers. So a lot of small things like these are done. So action point of view, I think we've done fairly well, given that we live in 48 degrees of, or 48, 60 degrees, 260 degrees of actual radiation in the summer. Thank you.
Thank you very much. Thank you. Thank you very much. Now, I have only 8 minutes left. I was
Sanjay, if you can give me half a minute, please.
Yeah.
I would like to add to what Rijvi have just told, the efforts of the government of India towards monitoring also. We in Ministry of Agriculture are planning to install about 6,000 automatic weather stations, primarily for crop insurance purposes. But those observations would be available for any other purpose also. And add to that about 2,000 of IMD. So we will have a network of about 8,000 observations across the country. So that should provide good monitoring.
It might just get hotter because of all the reporting, sir.
That's why I put that link to the present system. It's being augmented as of now. It's there in the chat box.
Thank you. Thank you.
Thank you.
Dr. Dr. Viswa Chitle, you are doing quite a bit. We are looking at from the outside as a think tank organizations, CEEW. How's your organization use climate atlas or similar model to help government to identify heat vulnerable region and prioritize actions accordingly, basically risk informed actions?
Yeah, thank you, Dr. Sanjay, and thanks to IWMI team for having me on the panel. Am I clearly audible?
Yes, please go ahead.
Okay, great. Yes, thank you. So, yes, I think you mentioned about climate resilience atlas or climate risk atlas. So we have been working on developing this open access tool called Climate Resilience Atlas, which will host all the data that we are producing or analyzing in terms of, say, heat index for India or heat stress analysis for various cities for which we are supporting the development of heat action plans. So, in a brief, when we talk about heat risk index, I think it's not only about dry temperature or daytime temperature anymore. It is also about how the number of warm nights have changed, how the humidity has increased across the different landscapes in India. So on 20th of May, we are launching our study on heat risk index for India, which has been developed using 34 critical variables in terms of vulnerability, health related data, as well as data on humidity, then data on very hot days, very warm nights. And some of the major findings from this study highlight the fact that there has been a massive increase in the number of very hot days in India in last 10 years compared to the baseline of 30 years before that. But what is more staggering is there has been even more increase in the number of warm nights compared to the increase in very hot days. So which is staggering because I mean often warm nights goes unaddressed, unacknowledged because you cannot see that impact as you see the sun during the daytime. But it has severe health impacts, as also Dr. Sally mentioned in her presentation. So we will be launching this study, and through this climate resilience atlas, all the data that has been produced at district level. So basically, we have developed this heat risk index for 734 districts, all the districts of India, and we will make that data available through this climate resilience atlas. As well as we are supporting currently 300 cities in India to develop their heat action plans. So also whatever heat risk index that we are developing for city level data for all these heat action plans will be also made available. So decision makers can really make use of this to identify the hotspots of heat risk in their district, their cities, and then develop their actions accordingly.
Oh, this is wonderful. I think we will look forward because, as you said, it's the 724 districts, a mammoth task in a different agro-eco regions of India. I can understand the volume of the work. My last point, very quickly, how this is going to strengthen the early warning for extreme heat, your atlas.
Yes, thank you. So I think, I mean, when we talk about that urgency of reaction or urgency of preparedness on the ground, I think this heat risk index really helps us to identify which wards are at the highest risk of heat and where is that vulnerable population that is located. So in terms of even even before the forecast of heat wave starts coming from IMD, the city authorities can start preparing themselves ahead of the summer season in order to respond, in order to prepare to take action on heat, similar to what many cities do for monsoon in India now. So I think that will definitely help them in strengthening the preparedness measures in these particular priority wards, as well as when we talk about state level preparedness. I think a state disaster management authority can also use our heat risk index at district level to prioritize some of the districts that are likely to get impacted more than the other ones while impacted while facing the impact of heat waves. So in this way it will definitely help the decision makers to enhance their early warning mechanisms and response time.
Thank you, Dr. Viswa. I have been alerted by colleagues that time is coming to an end, but we really have wonderful discussions. The most exciting part of this, we heard from scientists, we heard from a medical, the health expert, we heard from the real practitioners, the science for the practitioners, which Dr. Bhan represents, then the real policymakers, many innovative, brilliant idea came through NDMA initiatives from Rijvi Saab, and then finally to you. And we really applaud. This is a huge task, and we are looking forward to see the climate resilient atlas and how it is going to contribute. This will be a great learning for many part of this region. So thank you very much, Giriraj. Over to you.
Yeah, thank you, Dr. Sanjay, for moderating. I do see that time is a limiting factor for such a big topic and all the global experts and the national level lens we have given on the heat wave work. I really thank all the speakers and panelists for giving this opportunity on behalf of International Water Management Institute. Really thank all of you. We could be summarizing. I think some of the questions we haven't responded in the Q&A chat box. We will review that and put it in our webinar summary report, and you will be all receiving the summary later next week of this session. So on 20th May, we are covering the next part of the webinar, which is about advancing flood forecasting and early warning. We will have global experts again with a set of moderation from different experts around the world. So I would request my colleague to share the webinar details in the chat box, and of course we will post it in social media for your participation. So thanks again for all your support and being with us for this important topic. Thank you,
Yeah.
everyone.
Girira, just last one-liner from my
Sure.
side. I must applaud you and your team for picking up a subject which is most, in today's context. I think you have seen UN Secretary General call for action on heat waves. The way you have developed this whole ideas, practitioners, scientists, and the think tanks. It's a brilliant piece. Keep it up. It's a great service, particularly to combat heat waves, which, as I said, is going into the hard adaptation way. Thank you, Giriraj.
Thank you.
Thank you, everyone. Thank you. Bye.
Okay.
Thank you. Bye.